Good wishes, everybody. I am Dr. Aravind, consultant diabetologist, Dr. Aravind Diabetes Center, Basveshwar Nagar, Bangalore. So, first of all, good wishes to all of you on the occasion of World Diabetes Day, which is on November 14th. Every year it is been celebrated with a different theme. This year's theme of World Diabetes Day is access to diabetes education. So that's why I thought I'll say a few words regarding diabetes. So I'll be talking on diabetes in young. Nowadays, if you see, diabetes is occurring in a younger age group. So if you take the diabetes, there are two major types of diabetes, that is type 1 diabetes and type 2 diabetes. Type 1 diabetes, also called as insulin dependent diabetes or the juvenile diabetes. That means it occurs in an earlier age. It can occur in any age, but most commonly seen in younger age group. The age group being around, on an average, is around 13 years. What does type 1 diabetes means? The pancreas doesn't produce any insulin because of the complete destruction of the beta cells. So you need to treat these patients with only insulin. No questions of tablet at all. Lifelong, the patient needs to take insulin and he'll have a healthy life and he can have a comfortable life also. But only thing is he need to take insulin without fail. Next is type 2 diabetes. It's usually called an adult onset type 2 diabetes. Usually earlier we used to say it occurs above 35 to 40 years. Nowadays what we are seeing is type 2 diabetes is occurring in younger age group also, that is in children also. So we need to take care of this. So education plays an important role in preventing this onset of type 2 diabetes in younger patients. So if you take the treatment of diabetes in general, there are three types of treatment mainly. One is the diet, second one is the exercise, and the third one is the doctor's advice. The first one is exercise. Yes, most of us have to do exercise every day without fail, because you can always start slow, like you can start with 15 minutes walk or so, but gradually it has to increase 1 hour per day on an average of 5 to 6 days per week. So main thing is any type of exercise you can do, like it may be swimming, badminton, cricket, football, marathon, what if of your choice. Any exercise of your choice, it has to be done along with the muscle training also, muscle building also to certain extent. If not anything, at least you can do walking. Like I always say, 10 minutes of walking and 10 minutes of warm-up exercise, 30 minutes of walking, and 10 minutes you can finish it up with the yoga and meditation. Next come the important aspect is exercise. Exercise is the diet. The exercise part I discussed. Next comes the diet part, which is very important, because diet is an important aspect in everybody's life. So always you should avoid junk foods. Always eat plenty of vegetables or fruits. Plenty of fruits can be taken. And when it comes to non-vegetarian, you can take proteins, that is chicken without skin, or fish or egg white can be taken. Red meat should be preferably avoided. So main thing is youngster is the fast food. They get easily attracted with fast food and they tend to take this fast food and develop all sorts of problem, because these fast foods are rich in all these oily items, and they are rich in carbohydrates, which is not good for health in the long runs. So ladies and gentlemen, my take home message for this World Diabetes Day is education plays an important role in diabetes management. So as a parent, take care of your children with a good exercise, good diet pattern, and good lifestyle. Always keep away from mobile, keep away from all the social medias and all those things. Instead of wasting your time, in the same time you can do the exercise, eat proper food, drink plenty of water, keep your health safe. Prevention is better than cure. So it is not always when the disease comes you run around. It is always better to keep yourself fit and to have a healthy and longer life. Thank you so much. Namaskaram.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.